This is the joint mobilizations of the hip by Scott and Tiana. Hi Megan, my name is Tiana Hoffman. I will be your student massage therapist for today. We will be doing a few mobilizations on your hip. This can be considered a sensitive area, so if at any time you feel uncomfortable, please just let me know. You shouldn't feel any pain at all, but if you do, let me know so I can stop or modify the treatment at any time. We'll be doing an anterior glide to increase hip extension and external rotation, a posterior glide to increase hip flexion and internal rotation, an inferior glide to increase hip flexion and a hip distraction to increase a mobility of your hip and increase abduction movement. You should expect a slight bit of pain to no pain during or after the mobilizations are done. Do you understand everything we've discussed?
Yes.
Do you have any questions?
No.
Do I have your consent?
Yes.
Thank you. So now I would start by warming up her leg by doing effleurage and petrissage, but because it's not exactly necessary for me to have it on tape, I will not, but I did indeed do it. First, we're going to start with the anterior glide of the hip. So I'm going to be placing a towel under her ASIS, which is the anterior superior inferior spine, so that I don't crush the ASIS into the table while doing the mobilization. So, get you to lift up. Put you down. Okay. And the knee is to be placed in hip flexion while the patient is lying prone. I start by holding the knee with my stable arm and pushing the femur, finding the head of the femur and making sure that it's not the greater trochanter by moving the hip into external and internal rotation and finding that head of the femur by doing that movement. So this is where the head of the femur would lie, and this is where I would be doing the mobilization for anterior glide. So starting with grade 1, I'll push a little bit in and see if there's any pain. Is there any pain?
No.
Okay, and then I'll move into grade 2, which is also used for pain. Is there any pain there?
No.
Alright, and then within 3 or 4 we're going to do oscillating, and I would do this for 7 seconds and 3 times once I get to grade 4, but we're going to start with grade 3. So, any pain?
No.
Alright, so now doing to grade 4, and I'll do this for 7 seconds. Grade 4 is inside of the end range and is to be done 3 more times after that. Anterior glide is used for increasing joint play and capsular stretch to encourage external rotation and hip extension as well as extension range of motion. Alright, so the next one we're going to do is posterior glide of the hip. So I'm going to stand on the opposite side of the body for me to have better support over the leg. And so what I would do is get up on the table and put the knee into 90 degrees of flexion as well as the hip, and wrapping my arm around and this is my mobilization arm, that's going to be on top of the knee, and I'm going to use my stable arm under the femur to feel the mobilization going into the table. I'd wrap my arm around into the junction of the popliteal fossa and pushing onto the knee so that the femur gets pushed into my arm. I would do a grade 1 mobilization. Any pain?
No.
And I'm going to do a grade 2. And any pain?
No.
Alright. And grade 3. Any pain?
No. Alright,
so now I'm going to do 7 seconds of a grade 4 oscillating mobilization, and I would do this 3 more times after I do this one. Alright, perfect. And I would do that until I hit end ring. This technique can be used to increase joint play and necessary for internal rotation. So now we're going to do the inferior glide of the hip. So we're going to have the knee and the hip into 90 degrees of flexion, okay? And I'm going to place both my my stabilizing hand and my mobilizing hand on the groined area, but not actually touching the groined area. And I'll start with a grade 1 and see if there's any pain, and then move on from there. So we'll start with a grade 1. Any pain?
No.
Okay, so we're going to do a grade 2. Any pain?
No.
Grade 3. Any pain?
No.
Alright, so we're going to do a grade 4 for 7 seconds, and I would do it 3 more times after that. Okay. Alright. This technique can be used for capsular stretching to encourage accessory motion necessary for hip flexion and rotation, and I would do the grade 4 oscillating at end range. And finally, we're going to do distraction of the hip. So to do this, you have the patient in supine, and then I would put in 30 degrees of flexion, 30 degrees of abduction, and 20 degrees of external rotation, grabbing at the distal end of the fibula and tibia, and I would do the distraction at the long axis of the femur. So first we'll do grade 1, and that's any pain?
No.
And then we'll go to grade 2. Any pain?
No.
Grade 3. Any pain?
No.
Alright, and grade 4, oscillating, and I will do it for 7 seconds, and I would do it 3 times. I'm only going to do 1 for the video. Perfect. And I would do this one at end range as well for the grade 4. This technique can be used for decreasing muscle spasms or pain. Is also useful to increase accessory movement for flexion and abduction movements. Thank you.